Hello everyone and welcome to my YouTube channel. Today we'll be discussing on Buerger's disease, which is also known as thromboangiitis obliterans, which again is also known as TAO. Now if we see the terminology, thromboangiitis obliterans. Now thrombo here stands for thrombosis, which in simple terms is blood clot. Angiitis is nothing but inflammation of the blood vessels, and obliterans, which is obliteration of the blood vessel, or there's a block of the lumen or the space in the blood vessel. Now, Buerger's disease. The name Buerger's disease is because this particular disease was explained or described by a person known as Leo Buerger in the year 1908, which was further improvised in the year 1924. So, because of this man who gave the description, it is named after him, which is Buerger's disease. So, this particular disease can be called as Buerger's disease, thromboangiitis obliterans, or simply TAO. Now, this is a disease of the arteries. So, before we move into the topic, let's see artery, or let's see what the wall of artery consists of. So, the artery has three layers, that is the tunica externa, the tunica media, and the intima. Now, the tunica externa is made up of connective tissue. The media has smooth muscle cells and also elastic tissue, and the tunica intima has endothelial cells which overlies a loose connective tissue, which is also called as lamina propria. Now, here the lamina propria consists of coagulation factors and the endothelial cells overlie. So the importance here of endothelial cells is that they help in regulation of the blood flow, and any disruption or injury to the endothelial cells leads to the blood coming in contact with the lamina propria, which has coagulation factors. Now, as obvious, if this happens, there's a formation of blood clot. So, with this brief background, let's go into the disease. Now, what is Buerger's disease? Now, we know that it is a disease of arteries, but here there is vascular inflammation. That is, there is inflammation of the arteries. Now, the special feature of this particular disease is that it affects only the small and the medium-sized arteries and not the large arteries. Another thing is that it is a recurrent disease, that there are episodes where there is an active phase and followed by which there are absence of symptoms. Second is it is segmental, that is the entire length of the artery is not involved, only a certain portion of the arteries or certain length of the artery is involved. And here it is non-atherosclerotic. Now, here it is not because of the formation of atherosclerosis or atheromas. Here it is because of the formation of blood clots. Okay, so here it involves small and medium sized arteries and it is non-atherosclerotic. Now, what you see in this picture is it's an arterial and venous system connection. So here you can see that this is the large artery. This branches to form your medium-sized arteries, which further branches to form your arterioles, or which is also called as a small-sized arteries. Now, at this junction of the capillaries, there is exchange of oxygen and nutrients between the blood vessels and the tissues. So once the blood loses its oxygen and nutrients, this is taken back by the venules or the venous system. So here again you have the veins, there is the venules, and then you have the medium-sized veins, and then you have the large veins. So this is the basic system of blood exchange or tissue exchange in the body. So here, as we learned that it affects only the medium-sized and the small-sized arteries. So this you have to keep in mind. Now, if you see the definition, which is given in the textbook authored by Das, it goes by, it is the inflammatory reaction in the arterial wall with the involvement of the neighboring vein and nerve terminating in thrombosis of the artery. And again, very important, it is the inflammation of the small and mid-sized vessels of extremities. So as we saw in the name or nomenclature, there is angiitis, that is inflammation of the arterial wall, because of which there is a formation of thrombus and ultimately it is causing the blockage. Now, if you see some risk factors, this particular disease is more common in the men and who are in the age group of 20 to 40 years and who have a habit of smoking. Now, it's not a normal smoking. I mean, not just two, three cigarettes per day. It should be a minimum of 20 cigarettes per day. So, a man in the age group of 20 to 40 years with long-standing or chronic cigarette smoking, around 20 cigarettes per day, is more prone for this particular disease. And if you see the women sex, they are less prone to this particular disease. And if you see the ethnicity, it's more common in the Jews. Now, if you go to see the causes, there's no exact cause known here, but some associations have been noticed. So, as we discussed earlier, cigarette smoking is one of the major causes for this particular disease, and it is almost 20 cigarettes per day and above can lead to Buerger's disease. Then hormonal influence is also said to have a strong association. That's why we see that this particular disease is more common in the males. Another one is the low socioeconomic age groups. Now, in these age groups, what we see is the hygiene levels are poor, and in their blood, if you see the fibrinogen levels are higher. Now, because of this, the blood has a hypercoagulable state, and there is which leads to more aggregation or hyper aggregability of the platelets. There is a familial predisposition also, that is, genetics is also involved here. And if you see the race again, as we saw, the Jews are more prone. And one more thing is the blacks are rarely affected. And there's one more theory which suggests autonomic overactivity, because of which they can lead to spasms. Again, spasms can cause damage to the endothelial cells, because of which the blood comes in contact with the lamina propria. And again, there can be formation of blood clot. Newer theories are suggesting that there may be autoimmunity here, but it's not confirmed yet. Overall, if you see, this particular disease is having an immunological process, and if this may be triggered by cigarette smoking. So these are the causes. We have to remember that smoking has a very strong association with this particular disease. Now, if you see the basic pathology here, there is inflammation of the blood vessels, because of which there is, destruction of the endothelial cells. The blood comes in contact with the lamina propria, blood clots, which leads to the formation of blood clot. And as this process continues further, uh, as the inflammation proceeds, the blood clot becomes bigger, and there is fibrosis of the vessel walls, which leads to the narrowing of the blood vessel and ultimately causes decrease in the blood flow and leads to ischemia. Now, if you see the word meaning of ischemia, it's nothing but the effects seen in the tissues because of less blood supply or hypoperfusion of the tissues. Now, getting into a little more detail about this particular disease. So, as we said, this is an inflammatory process, and this causes where you can see the walls are having a dense fibrotic reaction. As you know, the end result of inflammation is always fibrosis. So here, also after a period of inflammation, the walls are basically covered with fibrous tissue, and again, as we had seen earlier, the lesions or the affections of the arteries are segmental. That is, not the entire portion of the artery or not the entire length of the artery is involved, only a certain portion or fraction of the artery is involved. And again, focusing on this, it is involving only the small and medium sized arteries, and the larger arteries are spared. So if you see the sites, it affects both the upper extremities and the lower extremities equally. So in the if you see the upper extremities, it is usually seen distal to the forearm, that is in the areas of the wrist, as you can see in this picture. Usually the parts after the wrist, especially in the fingers or the distal parts, are involved here. And in the lower extremities, it is usually after or distal to the popliteal arteries. Usually the tibial artery is involved here. And some cases, It's also reported that the vessels of the GI tract, the lungs, and heart are also involved, which is but rare. Now, one more associated feature with this disease is there is recurrent superficial uh, phlebitis or inflammation of the veins, which has its own manifestation. There can be redness of the skin and there can be pain. So, migratory recurrent superficial phlebitis is also a feature of this particular disease. Now, coming to the acute lesion. Now, as we know, in any acute inflammation, there is infiltration of polymorphonuclear leukocytes and other immune cells. So if you see the walls, you can see that the walls are infiltrated with these leukocytes, and because of damage of the walls, the blood comes in contact with the lamina propria and the blood clot begins. Okay, so if you see the thrombus or if you see the blood clot, even this particular blood clot will have cells of the or will have PMN cells or the polymorphonuclear leukocytes and giant cells. And these blood clots, if you go for a more microscopic study, you can see further microabscess. Again, because of the tissue cell destruction, you find a lot of abscess formation within the clots, and you can see the immune cells. Okay. Now, if you go for the chronic lesions, um, when the acute inflammation settles down, it results in the fibrosis of the arterial wall. Now, sometimes this particular phenomena also extends to the vein, or that is, the fibrosis extends to the veins and the nearby nerves. So initially, the thrombus is formed, and this thrombus consists of your blood cells and the fibroblasts and your polymorphonuclear leukocytes. Uh, and once they settle down, or which is also called as organization, um, the cells are more of the fibroblasts and the elastic tissues. Okay, so as you can see in the picture, initially the the in the acute phase you can see a lot of neutrophils and giant cells, but as the inflammation progresses, there is organization taking place. That is, the thrombus settles down. So here, the if you see the cells in this, there'll be more of the fibroblasts and the platelets and the red blood cells, and the less of the lympho or the immune cells. And if you see in this picture, initially there'll be only of fibroblasts. Sorry, I'm not fibroblasts. There'll be only a thrombus formation, but the blood vessels will be spared, or it's just the beginning. So the blood vessels, the walls of the blood vessel appear normal. But as this particular phenomena progresses, the blood vessels also undergo fibrosis, or there is a deposition of fibrous tissue in the walls, which causes the narrowing of the lumen, and which is further worsened by the already present blood clot. So what happens is there is decreased blood flow to the tissues. Now, if you see the clinical features, usually, if you see the history, a person in the age group of 20 to 40 years, and he will tell you that I have been smoking from a very long time, and I have been smoking a lot of cigarettes every day. So this will be how a patient will be presenting to you, and he may also give you certain signs of ischemia. So because of the reduced blood supply, you can see certain signs which we will discuss in the coming slides. And he may also complain, or he may give a history of recurrent superficial phlebitis. Okay, so a male in the age group of 20 to 40 years with a long-standing smoking history, and which who gives further symptoms of superficial phlebitis, always suspect Buergers disease in the background. Now, if you see the symptoms as such, um, since the pedal arteries are involved here, the patient may complain of pain while walking, and the site of pain will be the arch of foot. So, whenever the patient walks, the patient may experience some kind of pain. So, this is called as foot claudication or claudication pain. That is, whenever the patient is having some motion, there's a pain, but when the patient stops or he takes rest, the pain reduces. So, the pain can be seen in the arch of foot. Sometimes the patient can also feel pain in the calf region, But other than these two areas, the patient may not experience pain. So there is no pain in the thigh or buttock. So if there is a pain in the thigh or buttock, this condition is ruled out. And if you see if the upper extremities, the arteries of the upper extremities are involved, the patient can complain of pain in the wrist and the fingers. And here also, like we saw in the lower extremity, the patient complains of pain whenever there is any kind of exercise or motion. So this is called as intermittent claudication. So as this particular process or phenomena continues, it leads to ischemia. Okay, so initially there was less ischemia, then as it progresses, the ischemia increases. So this can produce postural changes. Now, what do you mean by postural changes? So, for example, if the leg is affected, if the person hangs his leg down, there can be congestion. And if the patient raises his leg up or his hand up, that time you can see pallor. So what happens, already the blood vessel or artery is blocked. So if the limb is left hanging, or in a dependent position, it helps in the blood flow, so you can see that particular congestion. But if the patient is asked to raise the hand, this the gravity acts against it. So already there's a block, and because of the gravity, the blood flow further reduces, because of which there is a kind of pallor or blanching seen. So this is called postural changes. So this can be also the patient can complain about these things, or this can be observed if in this particular test is performed. Okay, postural changes. And certain trophic changes also can be seen. Now, what do you mean by trophic changes? So because of ischemia, what happens is the tissues, they receive less nutrients and less oxygen, because of which the skin becomes a little thin. The hair in the skin or around the fingers or the toes, they may start falling off. So that can also be seen. The nails start becoming brittle, and you can see some transverse ridges on the nails. So the patient may complain, or he can also observe on examination these particular points. Now, as this particular phenomena further progresses, it can lead to the formation of ulcers, as you can see in the pictures. If this is again further not treated, this can lead to gangrene. And if it's not controlled, this becomes one of the major reasons for amputation. So one of the major features of this particular disease is that the ulceration and the gangrene, sorry, the ulceration usually starts in the distal parts. That is, you can see here in the toes, in the toes here and in the fingers. So the tips of fingers and the toes are first affected, and gradually they proceed proximally or towards the hand. Okay, so this is how the disease progresses from the distal to the proximal. So if a gangrene or ulcer is seen not in this pattern, then Buerger's disease can be ruled out. Okay, and yeah, further the pain can also be because of the phlebitis and the neuritis that is associated with this particular disease. Now, as the disease further progresses, as we had seen earlier, the patient initially complains of intermittent claudication, that is pain only on walking or doing some exercise, and which gets better by rest. So with the progress of disease, this particular pain uh, persists even when the patient takes rest. That's why it's called as rest pain, which slowly becomes more severe, and this disturbs the sleep of the patient. So as you saw in the beginning, it is only a claudication pain. This becomes a rest pain, that is, even during rest, the patient may complain of pain, and which further progresses so much that the patient does not have sound sleep. And to ameliorate this pain, or to feel better with this pain, the patient may hang down his legs. Okay, if it is a hand, he may hang down his hands. If it is a leg, he may keep in this particular position. He may hang down the legs. So what this may provide a certain a relief for a brief period of time. So the patient will come to you and say that I feel better when I hang down my legs, or if I keep my hands down. Okay, this provides a certain relief in the symptoms. Now, if you see the inspection, I mean, if you see on inspection, you can see that the particular part that is having ischemia is demarcated. That is, it is clearly, it is separated from the area that is having a good blood supply. And as we said, you can see trophic changes or ischemic changes. So you can see a loss of hair, you can see atrophy of skin, and you can also see brittle nails and transverse ridges. Now, if you go for the palpation, now two major pulses are involved here, which will help you to, kind of find out if it is a Buerger's disease or not. So, the most frequent finding is absence of the posterior tibial and the dorsalis pedis pulses. And further, if there is an absence of the posterior tibial pulse, it is highly suggestive of the diagnosis. And this, if it happens bilaterally, it is even more suggestive of this particular disease. If you see in the upper extremity, the radial pulse may be absent, and when it is bilateral again, it is suggestive of Buerger's disease. Okay, so remember this: the absence of the posterior tibial artery and the dorsalis pedal pulses will be absent, of which the posterior tibial pulse absence is more important, or which is highly suggestive. So this pulses will not be felt. Now, if you go for the investigation is arteriography. Now, how is arteriography performed? Now, arteriography is nothing but an X-ray. It's a little modified. So here they inject contrast dye. So on X-ray, what happens is this particular dye absorbs the light and it is highly visible. So as you can see in the picture, the blood vessels are clearly visible because of the dye that is injected. Now, there are three words that are appearing here, that is the corkscrew appearance, the tree root, and the spider legs. Now, why these things are happening here, or why these particular appearances are seen, is because if there's a particular block here, for example, if you see this particular portion, after this particular its portion is getting a little dim. So there's supposed to be a block here. You can see here also. So you can see that there are a lot of tiny blood vessels, kind of coming out from this portion. Now, this is a compensatory mechanism. Because of the block, there are collateral vessels formed in order to sustain the tissues. So this particular uh, formation of blood vessels is called as a tree root or spider leg. And there's one more particular phenomenon that is also a phenomena, or not phenomena, appearance, is called as the corkscrew appearance. Now, this is because of the damage to the blood vessels. That is the fibrosis of the blood vessels. They take the shape or the appearance of the corkscrew. So on investigation, you will find this particular appearance. So to summarize this, Buerger's disease or thromboangiitis obliterans, it is a disease of the arteries, and here there is a peripheral vascular inflammation. One important things to remember here is they involve only the small and the medium sized arteries, and they are segmental. There is a segmental occurrence here, that is not the entire length is affected, only a small portion of the artery is affected, and it is non-atherosclerotic. That means if you go for investigations, the cholesterol levels will not be high, they will not be having high blood pressure, and neither they will be having any features of diabetes. Okay, so non-atherosclerotic, or people who are not having any risk for atherosclerosis. So there is inflammation of the blood vessels, there is a formation of the thrombus, because of which there is ischemia. Now, because of the ischemia or the block, because of the thrombus formation, we can see signs of ischemia. Now, the site here is very important. Usually takes place in the foot and in the lower extremities, and in the upper extremities, it is distal to the wrist. That is, usually the fingers are involved, and you can see claudication pain, you can see rest pain. Further, if it progresses, you can see ulceration, which further progresses to gangrene. And one more thing important here is that these particular affections are seen at the tips of the toes or fingers, which spread or move proximally. So, yeah, and one more thing is on investigation, you find corkscrew appearance and tree root appearance or spider-like appearance. So, with these few points, we end today's topic on Buerger's disease. Thank you very much.